and I'll be the person conducting the student interviews today. First interview is going to be with Ms. Catherine Bailey.
I think it's transmitted through blood.
And the next student we're going to interview is Miss Alexis Vaughn.
I didn't think there were any symptoms. I thought you just found out when you got tested.
And our next student that we're going to interview is Miss Gabby Small.
I think there were any treatments to hepatitis B. I just don't know.
You guys have gotten the vaccination?
Pretty sure I have gotten my vaccination. Yes, I got the 3 to 4 sets of shots before I came to college.
As you can see through our short interview, not every college student is properly educated about the STI hepatitis B. This specifically transmitted infection is the most serious liver infection in the world. Hepatitis B is 100 times more infectious than the AIDS virus, yet young adults are not properly educated. With this public announcement, you will now be educated enough to understand the causes, transmission, symptoms, prevention, treatment, statistics, and images of the infection. The main cause of hepatitis B is when an infected person's blood, semen, or vaginal fluid, which includes the menstrual blood, enters a non-infected person's body. The common ways of transmission is through sexual contact, sharing needles and other equipment, body piercings and tattoos, or as Catherine Bailey answered in our interview, through bodily fluids such as blood, which can be handled at work. When infected with this STI, most people have the acute or chronic hepatitis B, which may not have any symptoms. As Alexis Vaughn stated in her interview that she was unaware if there are any symptoms for hepatitis B. But if symptoms do become present, they may include extreme tiredness, mild fever, headache, loss of appetite, nausea, and vomiting, constant discomfort on the right side of the belly under the rib cage, which is where the liver is located, diarrhea or constipation, muscle aches or joint pain, skin rash, and jaundice. A great way to prevent oneself from hepatitis B is by avoiding contact with bodily fluids of someone whose health or sexual health are unknown to you. To help this STI from spreading, most universities are now requiring students to get vaccinated. It is 95% effective to keep you from becoming infected with hepatitis B. As you saw in our interviews, each student had their 3 to 4 rounds of vaccination shots for this STI. Other ways to prevent hepatitis B include using a condom when you have sex, not sharing needles, wearing latex or plastic gloves if you're handling blood, and if you get a tattoo, making sure that the needle is properly cleaned and sterile. If infected, treatment all depends on how progressed your infection may be. As you saw in the interview, Gabby Small was not properly educated about the treatment that is available. If you have not gotten the vaccination and were exposed to the STI, you'll need a shot of hepatitis B immunoglobulin and the 3 shots of the vaccination. If you have an acute infection, treatment with antiviral medication usually is not needed, but home treatment such as eating well, drinking plenty of fluids, avoiding drugs and alcohol usually help get rid of the symptoms. But if you have the chronic infection, the goal of treatment is to stop the liver damage by monitoring the amount of antiviral medication that is given to the person. If liver damage is becoming too extreme, a liver transplant will be needed.